right, good morning. All right, so we're about to do a upper all-on 6 for a patient. The reason why we're doing 6 implants for this patient, he has very large sinuses, and that's basically going to affect our distribution of our implants. So if you've been watching some of our other videos, we want to get the implants as far back as we can, but if that sinus is going to affect us because essentially the sinus is just a big air-filled pocket, we're not going to be able to, properly distribute the forces, and long term he'll have issues. So yeah, long story short, we're going to do 6 implants for this patient and do an upper all 6, and also we're going to take out a few bad teeth on the lower. Going to try to save whatever we can, but unfortunately his upper is a different story. And then the other issue too is that he has what we call a high lip line, so he has a high smile line. So when he smiles, he has kind of like a Julia Roberts type of smile where you see all his gums and stuff too. So it's going to be a little bit more of a challenging case. I tell patients that not every all-on 4 case is the same, so some are definitely more challenging no matter how many of these you do. But we're about to dive right into this, and I'll keep you guys updated.
Hello.
Having a blast.
What's going on so far? It's been an hour.
Yeah, I have all the teeth taken down, ready to place implants, but doing a quick sinus lift on the right side. Jackie, go do that dance again.
The chicken noodle soup, let it rain and clear it up. Let it rain and clear it up. Chicken noodle soup, chicken noodle soup. Put the soda on the side, chicken noodle soup. Not because I'm black, but just because I like chicken noodle soup. Now we get the fried chicken dance.
I've never heard of that before. What is that dance?
It came out in like 06.
Oh, did it?
Soup, you never heard that song?
No, I never seen that.
Yeah, we were dumb.
Oh, okay. I was in dental school. I was like
that's why.
in purgatory. Okay, so we just finished that upper all-on 4 case, and he had a few teeth on the bottom that we had to extract also because they were bad. But all things considered, everything went great. Again, I was reiterating this before we started the surgery. Every all-on 4 case is different. No matter how many you've done, there are just some cases that are more challenging than others. So, but all things considered, everything went great. So pretty happy with the result. About to now, take a lunch, and then we'll see what's going on in the afternoon. Hey, what's up? How you doing?
And are you eating lunch?
Yeah,
I'm sorry.
I just had a burrito. I just finished her, and then I swallowed a burrito.
No, she's giving me a tour because I've never been.
Oh, you never been here?
No. Well, I brought her, but I wait out.
Okay. See those beautiful teeth? Those are. Actually, it was funny because you first came in. We were gonna do a snap-on denture on you first, and then you were like, "The hell with that. Let's do all on 4."
Screw 'em. Not screw 'em, but screw 'em in. And it's funny because, I get so many compliments. Like the other day, a bunch of us playing cards. One of the gals across the table from me said, "Gosh, you've got the most beautiful teeth."
Oh, that's awesome.
And then I pointed to her and said, "She'll have them too."
Yeah. Once we get you in the zirconia. Yep.
Yeah, 20 and 26. I'm
Yeah.
counting the days that I'm gonna have steak.
Well, it's good to see you in
It's
person.
good seeing you.
I know.
Been a while.
Okay.
All right, see
Who
ya.
wants to see the office?
All right. Bye, Patricia. See ya. So today we extracted several kids' wisdom teeth, and there were different challenges and potential complications with each case. So I want to go over some of these cases with you. Stay tuned. You're going to learn a few tips and tricks in regards to what you need to be looking out for if you're going to get your wisdom teeth extracted, questions to ask, or even if you've already had them out and you got kids or friends that need to get their wisdom teeth extracted, you're going to learn a few things that you might be able to pass on this knowledge. So stay tuned. Okay, what's up everybody? All right, so this afternoon I'm just gonna be doing wisdom teeth. So every afternoon is different. I might be doing wisdom teeth or an implant or a gum graft or whatever it is. So anyways, spring break this week, and we got a lot of teenagers coming in. So today we have a 17-year-old. He's got pretty impacted teeth down low. They're all impacted, but these ones on the bottom are coming horizontally. Something to notice is that whenever you got these wisdom teeth coming in at angles like this, they have a tendency to cause cavities, and if they get bad enough, you actually have to extract your second molar, which is the tooth right in front of it. So that can happen right here, or that can also happen right here. So plenty of times in my career, I've seen cases where patients had to get their second molar out too. So anyways, I already looked at the 3D scan, looked at the proximity of the nerve to the roots, and it's actually pretty far, so should be no risk of paresthesia. So I've gone over this 3D scan with the patient already, but yeah, looks pretty standard. I'm about to get started here. So yeah, typically every wisdom teeth case we get them sedated before we get started, so should be a pretty quick and easy procedure. But how you feeling? Good? All right, good. Alrighty. Vitals look good. We got him on the EKG monitor, looking at his blood pressure and everything. So giving him his medications here for sedation, and gonna make this a pleasant experience for him. Well, as pleasant as possible, right? He won't remember anything. That's the beauty of it.
When did you get your wisdom teeth out?
I was 18.
Were they hurting or did you just want them out?
No, so I went to my dentist and I was 18 and he was like, you should get your wisdom teeth out. To this day, I never even looked at my x-rays, but he just said, get them out. And I was like, all right, cool. He's referred me to an oral surgeon, got my wisdom teeth out. I literally didn't even have a consult with him. I just showed up on a Saturday morning at 8, walked in, drugged me up and took out my wisdom teeth. But yeah, my wisdom teeth were not very impacted, I think, because the next day I was playing basketball. Like seriously, like I had no discomfort. I didn't take any pain medication at all, not even ibuprofen. So every case is different. If it's less impacted and you get them out at a young age, then it should be a pretty easy experience and you're fine the next day. Sometimes I had patients come in and be like, oh my God, you did so amazing, this and that. And I was like, I'd love to tell you that's because I'm an amazing surgeon, but it honestly is just how invasive they are. So if you're a teenager, your bone's nice and soft, it's gonna be a much easier experience versus if you're older, super impacted, all that stuff.
Yeah, can you get mine now?
Yeah. We'll take a look.
If you guys film me, I'm not editing it.
All right, you feeling all right? Okay, let's get started. All right, so about to just finish the set of wisdom teeth, about to start another one right now. So spring break week apparently, a lot of teenagers coming in. Hey, what's up, man? How you doing? Good seeing you. Oh yeah, these are way easier than the last ones. My last patient. All righty, do you got any questions before we start giving you the meds? The last one was kind of hard. It wasn't hard, but it was hard for a 17-year-old. So let me give you the rundown on wisdom teeth here, okay? So some cases are easy as heck, right? Like this case is like a easy as heck type of case where it's gonna take you a few minutes. Then we got your other cases where, you know, you could be removing wisdom teeth for 50 years and it's still gonna take you like a long time to remove these wisdom teeth. They're a difficult case. So every case is a case by case basis. What we have to do is we have to look at your panel, then we look at your 3D scan, you know? But, you know, why do I tell you this? Is like his recovery is gonna be a heck of a lot easier. So when my kids are like 15, you know, I'll probably start getting some scans at that time to see whether they're a candidate to get their wisdom teeth out, because you want your kid to have the easiest extraction with the least amount of complications, right? So yeah, this set of wisdom teeth is way easier. Patients always ask, you know, in the past, patients are like, oh, you're so amazing at removing wisdom teeth, and it's not that. It was, you're just an easier, less invasive case, you know? I just saw 2 siblings, one's 19 and one's 17. And the older brother, who's 19, his wisdom teeth were way more impacted than his sister's. So, you know, if we were to see both of them the day after surgery, like he's gonna look like he's swollen, and then his sister is probably gonna look like nothing even happened. You know? But yeah, this looks like a case where he's gonna swell very minimally, if anything. So fun fact, whenever you're doing sedation, the whole goal of it is so that the patient doesn't remember anything, okay? So we still have to numb up the patient. That way they don't feel anything. Sometimes people don't know that, but yes, we sedate them, they're not gonna remember anything, and then we start administering the local anesthesia, so we numb them up. And then we take out the teeth. Gum here. So we have to make an incision to get into there. Otherwise, you're not going to be able to find it. And then once we make our incision, we then go in underneath the gums, gently reflect back the gums. And then in this case, I can actually see the very tip of the tooth. So I can go in and elevate it out. Now it's not always the case there, it's like this easy, because sometimes I have to go digging, remove some bone and dig and remove some bone and cut the tooth up, and there you go.
You got it?
Yep. Okay, so I literally just finished a set of wisdom teeth right now on a 14-and-a-half-year-old patient, but I wanted to let you know I did that surgery because the patient is actually currently in ortho. Her second molars are having issues coming out because her wisdom teeth are kind of obstructing them. Long story short, we got these wisdom teeth out, and then you might notice, like, you know, again, how high these wisdom teeth are. These second molars kind of get in the way. But I also had another patient who I literally just saw as a consult like minutes before I did this wisdom tooth surgery. And so I'd actually done her 2 older siblings. This patient is also, she's 14 years old. And so when I looked at her x-rays, I saw how high her upper left wisdom tooth was and also how much root development she had on her wisdom tooth. You know, I told her mother, you know, again, who I'd seen her kids before, and I told her, listen, honestly, I would probably wait another year before we go ahead and extract your daughter's wisdom teeth right now, because again, we don't have enough root development, and then the wisdom teeth are also too high up at the up close to the sinuses. So what am I really talking about? Well, whenever we're doing wisdom teeth, there actually is a better time to extract wisdom teeth versus other cases. So, you know, some patients ask, when's the right time? Is it like when I'm 14 years old? Is it when I'm 15 years old? Well, honestly, it's a case-by-case basis. Some people develop their teeth a lot sooner than others. Even my 2 kids, I noticed that my son developed his, you know, teeth a lot sooner than my daughter. So, you know, are they going to have like a different development around the age of 14, 15, 16? So all I'll say is that when my kids are about 15 years old, that's when I'll get x-rays to kind of evaluate what their situation may be, to find that sweet spot to get their teeth extracted, the wisdom teeth extracted. So there really is a sweet spot of when you should get your wisdom teeth extracted. You know, how much has it erupted? How impacted is it? If it's really impacted, is it going to improve? Like, is the situation going to get any better if you give it more time? How much root formation is there? Long story short, these all come into becoming different factors into whether you're going to be more likely to have more pain and swelling after your procedure, more invasive of a procedure, overall more discomfort and potential complications, right? But anyways, so those are like certain things that we have to look at, and really we can only figure that out by looking at the x-rays. So if someone is to ask me like advice, all right, so when should I get my kids' wisdom teeth out? I'd say, you know, 14, 15 years old, have your dentist look at the pano, and then your, you know, whoever's removing your wisdom teeth will basically be able to find that sweet spot in regards to like when it's going to be least invasive. At the same time, someone might sit there and say, well, why don't I just get my wisdom teeth out when I'm older? Well, the problem with that is that if you're older, your bone's a lot more dense. And then even if you're like mid to late 20s, your healing experience is going to be dramatically different than if you've done this as a teenager, when your bone is a lot softer, and therefore your procedure is more likely to be less invasive because you have smaller roots, again, softer bone, etc. Again, there's our pros and cons. You don't want to remove too early, so your surgeon's going to have to evaluate your case, and then also you don't want to wait too late, because the longer you wait, the more your roots can grow into your nerves, cause potential more complications, and etc. So anyways, just wanted to share that case as I am now about to step in my 4th set of wisdom teeth today after that all apart. So yeah, let's check out the next one. So the next wisdom teeth case is, all right. So yeah, on her right side, those are definitely really impacted. So she's probably gonna have more swelling on that side, but she doesn't have any root formation. I would say for an 18-year-old, if I didn't know any better, if I didn't know her age, I would guess she was like 15, 16 years old, but she's actually 18 years old. So, like any other case, I'll look at her 3D scan and basically, diagnose and how we're gonna approach her surgery. So, all right, I'm gonna head right into that surgery.